dismissive, I think is a good word that you get at typical doctors. Most other places don't have the experience, the understanding, kind of like an airline. They overbook patients, and I think that's one of the biggest problems. It's important to have a doctor that really understands autism or the developmental disability for a number of reasons. When they understand the issues, sometimes you might say, well, we have some gastrointestinal problems, or you might give some kind of problem. At typical doctors' offices, you tend to get a response of, well, that's kind of normal, all kids. It's like saying, my baby cries all the time. Well, all kids have colic.
I'd also like to add, at other doctors, I feel like they just don't understand. And here it's like they do understand, and I like that.
So when a child is first diagnosed with a developmental disability such as autism, there are a number of services and providers that are there to help address those medical needs. As these children age, however, what we're finding is that there are fewer and fewer services available, and the number of providers that have the skill set, the compassion, the understanding to really care for this population becomes more and more limited. So at FIU Embrace, what really is kind of neat about what we're doing is that we really have a lot more flexibility, we have a lot more time, when really we have specialized space, medical equipment to help care for this population, to really be able to address all of their needs and their concerns.
Well, there's a need to be flexible with this population. They have difficult time with change, and they can have behavior problems, and it's difficult for the parents to find sometimes caregivers that will help them.
One of the things we're most proud of with FIU Embrace Medical is the level of professionalism and experience of our medical staff and the supporting staff. Many of them have children that they care for. Therefore, the level and quality of care that we offer not only comes from a professional stance, but also from the lens of a parent.
When you walk in the doors, everyone is friendly. They really try to keep the mood, the environment, the lighting. It's for patient comfort. It's very, very patient-centered.
For those individuals that prefer to wait quietly in a separate area, to prefer to be more engaged using a laptop or some other technology, they are shown to the Starlight waiting room.
It's a much more calmer, softer environment, softer lighting, things that individuals can play with, do iPads, music, all of that good stuff to be able to make them feel more comfortable. Once the individual is at ease, the parents can actually really discuss what they need, right? They're not just coming in saying, hey doc, I need you to take care of this right now. No, these are all the things I need your help with, and we have the time to discuss it because now the patient or the individual, the affected individual, is at ease themselves.
I have a lot less anxiety and stress just thinking about, oh gosh, I gotta take my daughter to this doctor. I don't have that anymore. I'm not trying to think of all of the bad scenarios that can happen.
What we do that's different is that in one space we provide multiple disciplines, right? So primary care, internal medicine and pediatrics, psychiatry, OBGYN, and mental health counseling. At FIU Embrace, we're always working to better understand our patients' needs because we serve all levels of functioning, and that's something we're really proud of. So we're always looking to add different types of services and different types of providers for these families.
Looking ahead, we are working towards training the next generation of medical professionals and allied healthcare workers. We will be adding additional specialty services and moving from a part-time to a full-time practice.
So overall, it gives, I think, the absolute best quality of care.
I like this place.